This is not a bustling emergency room.
Thank you for calling DenverHealth. My name is Daisy. How can I help you today?
And yet, inside this call center, above the city of Denver, nurses field emergency calls.
Can I get name and date of birth?
Nobody wants to go to the emergency department and actually have to wait and or have to pay for an ambulance bill if they didn't need it. So our nurses are incredibly skilled and they're able to treat a lot of people at home.
Dr. Andrew Monty oversees the DenverHealth Nurseline. Patients can call it directly to talk through their health issue, or if they already called 911, they have the option to transfer over.
For instance, if a patient's got a bad flu, right? They're not sure exactly what to do, they feel horrible, and they call up, the nurse may very well tell them to take some acetaminophen, get some fluids into them, and they may feel better enough where they don't have to go to the emergency department.
In the nearly 1 year of this pilot program, Dr. Monty says the Nurseline fielded about 1,500 calls, 100 to 150 a month. He says almost half of those calls, 45%, saved an ambulance trip.
What that means is the ambulances are available for people that are having true emergencies. So that's the number one benefit. It's also less expensive, right? Because then the patients don't have to pay for that ambulance. And then, the health system actually doesn't end up with the patients in the emergency department that may not need it.
And sometimes the patient doesn't need an ambulance, but still does need a ride.
And so we can help in those instances by hooking somebody up with a rideshare option. And that means that if they do need to go to an emergency department, they actually can get there.
Aurora, Boulder, and Pueblo all have similar programs. And now Denver is considering extending this pilot into something longer.
The reasons to keep this going are, number one, patients like it. Number two, it saves money for patients. And then it also saves time and resources on the healthcare system.
Thank you so much for calling DenverHealth. You have a nice day.
So this is not just a question about ambulance necessity. This 24-hour Nurseline can also help people get into an urgent care, schedule an appointment with their regular doctor during business hours, or if the need is there, go right back to 911 and get that ambulance if the patient decides that they need it, Kyle.
You aren't going to get a bill for $1,000 a minute for talking to somebody, are you?
No. The Denver Health Line, they tell me this Nurseline is a free service. Now, if you end up going to the hospital, needing an ambulance, any other kind of medical service, you will be billed accordingly for your insurance or lack thereof. But just this phone call, no.
All right. Good to know. There's no meter running on the phone call.
No,
All right, Jennifer
no.
Meckles, thank you.